You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with small diameter or mini dental implants. According to my first guest, she says nobody should be wearing a loose fitting denture. We've had her on the program before, Dr. Sandra Low. Dr. Low, welcome to the program.
Thank you for having me, Randy. It's a pleasure to be here.
Good. Now, I know you brought a lot of photos, so we'll try to get to as many of those as possible.
Okay.
Now, for people that don't know your practice, I mean, you are a mini implant center. Who's the typical patient coming in for these mini implants?
Well, a typical patient coming to my office for mini dental implants is generally somebody who has missing teeth. And they could be missing teeth through trauma, through gum disease, or hereditary situations. And another category of patients would be those who are already denture wearers. And generally, we don't see those denture wearers because I remember most of us giving dentures to these denture wearers, and they feel like it's their end game, and they don't tend to come back except later for follow-ups if they have a sore spot or if they have relines that need to be met.
Are there a lot of denture wearers? Like in New York, I know it's a very hot,
Yes.
big populated place. A lot of people wearing a denture?
Absolutely.
Or headed to dentures?
If you, you know Yankee Stadium in the Bronx.
Yes, yes.
You could fill that stadium with 10 times the amount of denture wearers. And depending on the studies that you look at, there are 40 million plus people out there who are already denture wearers and are having a hard time with these loose dentures that they're adhering with glue.
So no more dentures.
So I think,
You think that's a thing of the past? Like the future of dentistry, maybe dentures as we know them today won't exist? They'll be attached to something? What's
Totally.
your take?
I think that the dentures would be obsolete at some point, and we will have everything attached, and there will be no more dentures. It will be it'll be the end of dentures.
Okay, good.
Standard of care.
All right. Now, in your center, I guess how dental implants are normally done is you go to one doctor that does the surgery, another place for the imaging, and then another doctor that puts a tooth on top. Like 3 people involved potentially.
Right, right.
You do it all yourself, all right there.
The advantage of doing it all in-house is that you can control the procedure better. You can place the implant in an angle to able to restore it with a restoration, a crown, or a bridge in the most pleasing fashion. If you end up sending it out, the other doctor may not know at which angle or which placement.
So you get a better what? Looking smile?
You get a better, more aesthetic outcome by doing it yourself. It's more controlled. So the biggest advantage of doing it all in-house is that the patient doesn't have to travel at different places, different appointments. I remember actually having a patient from the UN, and she came to me and I said at one point, you need an implant, you need this tooth taken out, and I referred her to an oral surgeon, and I expected that she had gone there, but a few months later she shows up in my office and I said, well, it's all done, isn't it? And she said, no. She just couldn't make herself go somewhere else. She was just so used to coming to the same place and getting everything done, and she didn't want to go somewhere else.
So people like that, like
Yes.
getting it all done in one place.
Absolutely. I think that in New York City, when and for anybody for that matter, time is of the essence, and they just don't want to travel to many different places. They have busy lives. They have children. They have obligations. So they don't want to travel to many different places and put extra work in their calendar. They have to go there at the right time and get these things accomplished, and different frame of mind. They want to make things simple. Like everything else, everybody wants to simplify their life. Less stress.
Now let's talk about mini implants versus traditional implants. You like these, and maybe even you love these. I think in the green room we said you really like these mini implants. So what's the difference?
The difference is that they're a third of the size of the traditional implants, and they don't need as much bone. The traditional implants need about 7 to 8 millimeters of bone. So the smaller implants, the mini implants, only need like 3 to 4 millimeters of implants. So when you're presented with a situation where a patient is going to have traditional implants, sometimes there just isn't enough bone, and we have to create more procedures such as sinus lifts and ridge splits or ridge expansion and bone blocks from grafts from your knee or your rib or hip. Those are just long procedures.
So you don't do that anymore? You don't have to?
I don't do any of that. And a lot of people who are doing mini dental implants don't have to do that. And that's a so much more simplified way of just getting to the end game, which is getting the patient back to function, having them bite and chew and smile so that they can get on with their lives.
Now, is this true that in certain cases, somebody could literally, on the day of the final procedure, that they could walk in with no teeth and walk out with teeth that don't come out?
Absolutely.
Really?
We do that all the time, Randy. Yes, it's just so magical for us and for the patient.
But you say it's life-changing for many people.
But Randy, of course it's life-changing. You take somebody who comes in with absolutely no teeth,
Okay.
or teeth have been bombed out, and in one afternoon you give them a set of teeth when they leave, their whole persona has changed. They become themselves again. And it's just, words don't express that. They just don't.
Now, when they see themselves in the mirror for the first time, do they get choked up?
Totally.
Are they surprised?
I get people who are choked up, they cry. Recently I had a patient who we did that on. We had her for the afternoon. Her mother was just so beside herself. She can't believe that this could happen for her daughter. And now her daughter's able to go out and meet up people and move on with her life. Whereas before she was housebound.
So if there's 1 million people, earlier in the program I said, are there a lot of people out there either headed to dentures, wearing a denture? If there's like 1 million or more people that have really bad teeth and can benefit from these small diameter implants, why aren't they all doing it? Like, what's your take?
Well, they're not all doing it because they don't know about it. That's why we're here on your show, trying to convey the message to all those people who can benefit from this procedure. One reason why they don't know about it is that in the past, we've delivered dentures, and that was the end game for that patient.
Okay.
They got their teeth, and they go home, and now it's all up to them to figure it out. And they get upset.
Good
they don't
point.
want to
So
come
they don't
back.
have to go back to the dentist. Like,
They
once you get a denture,
feel-
you're out of the system.
They feel like they're totally out of the loop. They feel like they don't have anything to come back for. They have their dentures, and the only time they come back is when they get loose and they need to get rid of sore spots that are developing because the bone has started to disappear.
Okay.
And the other reason is they need a reline. They need it to be tighter, so they come in for relines. Let me tell you about their life before they got the denture.
Okay.
They are going in and out of the dental office 15 years, 20 years, getting 30, 50 procedures, each one from a filling to a root canal, and each procedure is failing on them. Ultimately, it's an extraction, and then after an extraction, it's a bridge. Now we're destroying the adjacent healthy teeth, and ultimately they get to the denture. And when they get to the denture, it's a relief for them. They don't want to.
Interesting.
They don't want to hear any more about dentistry at all. They take their denture and they're gone. They don't want to come back and do it anymore. And it's hard to reach those people because now we have new technology and we have other options for them. We need to let them know that their lives could be better. And some of them are very complacent. They've resigned to the fact that this is all they have and they're not open to anything. But the truth of the matter is they really are afraid to come back because of the trauma that they've underwent, or the trauma of the dental work, and the trauma of the payments. They've made all these cumulative payments that have attributed to nothing in their minds.
Because they lost their teeth.
Exactly.
All that money spent, and then they lost their teeth.
Exactly. So they're very, very
So
disappointed
this is
people.
like a brand new set of teeth. We said this at the near the top of the show. Is it like a brand new set of teeth?
Yes,
like
it
your
is.
third set of teeth?
It's like a third set of teeth. And it's a shame if they don't take advantage of it, because now they can have teeth that are fixed, and this is as close as you can get to a natural set of teeth. Teeth that they once had before. They're fixed in, they can get about their work without thinking about the unpredictability of what may happen, whether it can come out. They can advance their lives, and it's great.
How soon can they eat? Okay, so if everything works out right, they get their new set of teeth, they go home, how soon can you eat?
They can eat straight away.
Really?
Of course, they have to be a little bit more careful because they
At the
didn't have
beginning.
because they haven't had teeth in a while, and their muscles are not used to it, and their jaws may be adjusted to a certain customized way of going.
Like you don't want to bite your cheek, kind of.
Exactly.
Thing.
I had a patient recently. He came in and he didn't have any teeth. He had broken partials that he hadn't worn in a while, and when we were trying to make his bite become ideal. He just couldn't go into that ideal bite. He was just going over here because he was just so used to it.
Okay.
So, when you get your first set of teeth from us, I would approach it with caution, and ultimately they'll get accustomed to using it, and they can pretty much eat anything they want. They
Like
can
a
eat
steak?
that. Oh, totally. They love eating steak.
Like what do they miss the most? Like these denture wearers, people that like salads?
I think it's the
What
whole.
do they tell you?
It's the whole. It's the whole experience of eating.
Okay.
Randy, we have 26,000 restaurants in New York City, and it would be a pity if people didn't take advantage of it. It's the whole, the food, the color, the texture, the fiber. If you didn't have that whole experience, the smell, the feel with your teeth, that's what they're missing basically. Because when you don't have teeth, you're choosing what you're eating now. You're strategizing about what can you eat on the menu.
They tell you this?
They tell me that. And a lot of people have got these little rules or little strategies that they don't want to tell their friends because they don't want to be a burden to their friends. They don't want to be a hassle to say, well, I can't eat this, I can't go to that restaurant, I can't go to that restaurant, I can't eat this. So in their minds, they have strategically decided, I can only eat this, this, and this. And
Okay. Wow.
they're being polite, and that's not how it should be.
How old can you be to do this?
I don't think age is a limit. I think that you can do it at pretty much any age from maybe 17 upwards. Some people go lower, some people go even higher into the hundreds. I have
what's your
colleagues who
oldest patient?
My oldest patients happen to be in almost 90. And they don't have a problem. New Yorkers.
Why would a person 89 or 88 years old want to do this, though?
Because they want to eat and smile and chew
Okay,
and do everything that
that's
you're
fair.
doing, Randy.
Okay.
I mean, when you hit that age, wouldn't you want to do all these things also, right?
Okay. It doesn't matter the age. I mean, statistically, they're not more likely to fall out on a 90-year-old than they are on a 70-year-old?
Not at all. Why would they be?
Okay.
I mean, they're coming into the practice. A lot of them are bouncing in. They have great personalities. I mean, they may be a little subdued because they don't have teeth, but when you give them teeth, their whole personality just pops out. It's just amazing. The humor. I mean, I had a lady recently, and she came in with a walker, and I thought, well, she's kind of grumpy, and I kind of stayed away from her. Turned out that she wanted to go forward, and we gave her teeth, and after the moment I gave her teeth, she became this huge other personality that I had never envisaged that she had. Yes, it was amazing, and it's great to be able to do that to somebody.
Is it more men or women? I mean, who's doing it the most? Because men put things off, right?
Men do put things off. Actually, I have both men and women. Okay. And you would think that the men are really, really quiet about it, but actually the men have like even more colorful personalities. They just don't say it.
Okay.
They exude it in the way they operate after when they get up from the chair and they're leaving. And they have kind of a little dance in their walk when they're walking out. It's just
all because of their new teeth, really?
All because of their new teeth, yes.
Okay. Now you brought some photos.
Yes.
What are we looking at?
Yes, I have some pictures. So this first patient of mine, she's a young lady, 37 years old, and she has a 12-year-old daughter, and she had a little hiccups in her life, and she wanted to come back. She made a great start by becoming a home health aid worker.
Okay.
And she had this personality that you don't really see when she first came in. As you can see in the picture, that's her smile.
She's smiling there.
She's smiling right now.
Okay.
She's smiling with her mouth closed. And when she opens her mouth, you can actually see that all her teeth have no crowns.
Oh, wow.
Most of her teeth are decayed, and for us, those are hopeless teeth.
That's got to be unusual.
No, this is not unusual at all. These people, you don't see that because they just decide not to smile.
Okay.
And you don't see what's in their mouth. And when you look at them, all you see is someone frowning or angry or something negative about them.
Can you spot that? Like, you know who's hiding their smile?
I can start to see that. I don't like to get into it too much.
Okay.
Everybody has their own issues, and their personal life is
But if they
theirs,
cover their
and
mouth with their hand, that's
they
a
do
dead
cover their
giveaway.
mouth. They either cover their mouth, or they grow a beard, or something of that nature, or they skew their mouth so that when they're smiling, it just covers that part of the smile that they don't like.
Okay.
And for this particular patient, what we did was
what were her options? I mean, what do you do with something like that?
Well, her options is denture, but she didn't want a denture. That's why she ended up with us.
Okay.
She came in through the door and she says, I don't want a denture. So what we did was we decided to take all the bad teeth out, which is pretty much all of them, and we placed some implants, and we gave her teeth. And we gave her a brand new smile, and as you can see, her whole personality is exuding.
Wow.
She has this self-confidence, almost a different type of person. Her daughter is just in disbelief. She's 12 years old, remember. She is totally in disbelief. Every time she goes home, her daughter sticks out her arm and says, "Bite me," just to make sure it's real. Yeah. So I am just so happy for her that she can go on to the next level in her life.
So it's definitely changed her appearance. So she can eat whatever she wants now.
She can eat whatever she wants. She likes apples. She's eating apples. She likes all kinds of different foods. She can enjoy those. She doesn't have to stay with the sugar, high carbs diets, which is not good for her. And she can go to a restaurant and eat and enjoy that whole ambience of enjoying the colors and the taste of the food. You know, you have to remember we're New Yorkers, so we love our food. So we have to embellish the thought of having a meal. We really get into that.
So denture wearers have a very tough time chewing, is what you're saying.
They do, because they don't actually chew. It's two dentures and it's just rubbing against the other one. And when that happens, the bone that supports the dentures disappear. That's why they become loose and they get sore spots. And that's why they end up coming back eventually, so that we could realign these dentures and make them more secure. And that's why it's a huge epidemic in right now, because there's so many people who are headed that way. And with the advent of dental implants, we can take care of that. We can give them new options. We give them fixed options where they don't have to use the adhesives anymore. They don't have to mess around with the gut.
So teeth that don't come in and out.
Teeth that don't come in and out, they can snap in, snap out, or they can permanently be cemented, and they can eat what they want. And it's just a life that they had before, a life that they recognized before, they could identify with, and they could be more confident.
They're back.
Yeah, they're totally back.
So what does she like better, the way it looks or the fact she could eat and chew whatever she wants?
You know, Randy, sometimes I have people come in and they just want to have function, right? I have the guys. The guys come in.
They want to eat.
They just want to eat. They don't care about how it looks. I'm thinking of a guy in particular, and he just doesn't care how it looks. Just so I don't have any pain, I can eat, I can chew. But later on down the line, they come back, and I'm like, well, you know, if you don't like anything else and you're having pain, then maybe we should just take these away from you. And he's like, no, I like the way they look. He doesn't want me to take them away now. He wants to keep them because he likes the look.
That's your little joke. That's a little bit of a joke, you say?
It's a little bit of a joke. But the thing is that he does like the way they look, although he put function as a priority initially.
Like he wanted to eat.
Yeah, and then you get the reverse of things when the women come in and they like to have a beautiful smile. They don't care whether they can function or not. But the function is a bonus later when they find that they can eat and chew and really enjoy their food. So all in all, we end up getting people to like both, which is great.
So you could kind of rebuild mouths completely.
Yes.
That's
and
your training.
It's kind of fun to do that because I feel like I'm a detective. It's like going into the practice and doing dental CSI every day. So when I get in there, I'm trying to figure out the puzzle and figure out the best way to do things in a most efficient, best timing, such that the patient doesn't suffer. And the mini dental implants is just a great adjunct to my armamentarium of my skills. And it's just wonderful. So after Beth Israel, what I did was that I further went on to learn implants, and I went on many missions in the Dominican Republic. And that's when we treated the indigent, and we learned surgery over there. And then I came back and I decided that, you know, a lot of these complex cases really you can do with the mini dental implant. And you don't have to do a lot of procedures. You don't have to do a lot of extra procedures, a lot of extra surgery, and that will benefit patients more. People who don't have enough bone, people who are medically compromised, they really can't sit there and endure many more procedures. Their immune system is low, and so they're already subjected to a lot of bacteria, especially from gum disease. There's
so
bacteria.
mini implants are just less invasive? Is that the main thing?
There's less invasive. less pain, and quick healing. And those are essential for people who are medically compromised. They need to heal faster. So these mini dental implants are just so ideal for these patients.
So it's like microsurgery, in a way.
It is microsurgery. And you know what? Frankly, the whole country and the health system is going towards microsurgery.
Yeah, I know you wanted to show some of these photos, so we have time for a few of these. Let's take a look.
This one is an executive assistant, and she's looking for promotion. She's busy. She has a couple of boys. And as you can see, her teeth have come out a little bit, and that's because she has gum disease. And the gum disease have compromised the foundations of the teeth. So the teeth are going in different directions on their own. So the decision that was made for her was to extract all the bad teeth. So her options were dentures, but there was no way I was going to give her traditional dentures.
Okay.
All right, with the mini dental implants that I know. So what we did was we gave her implants on the upper and lower, and look at that. Isn't that smashing?
Yes.
She has a beautiful smile, and it's custom to her face. The teeth are aligned according to a certain formula that we have. It's called the golden proportion, and everything is fitting such that she can smile, and everything is very sort of pleasant to look at.
I mean, that's changed her complete appearance.
Oh, totally, totally. If you look at the before picture, you can see that her lower half of her face is not really supported by the teeth that she has. But in the after picture, it's supported by the teeth that are supported by the mini dental implants. And she's able to function and smile better. Even her posture is better. Her airway is open, and oxygen circulation is whizzing around her face, and you can see that her complexion looks so much more nicer.
Yeah.
There's more energy in that, right?
Okay.
And she has a glisten in her eyes, and her eyes are not as sunken in as they were originally.
Very nice.
Can you see that?
Yes, yes.
Okay. Did you want to see?
Yeah, let's take a look.
This handsome guy happens to be 61 years old. He doesn't look 61, does he?
He's looking good. He's looking good.
So he came in, and his teeth were periodontally involved. That means that he has gum disease. The foundation are just bombed out.
Couldn't save him.
Couldn't save them at all. The teeth are unstable. They're moving, and we decided to take all his teeth out so that. One thing, he really didn't want a denture at all.
Okay.
A traditional denture was not an option in this case. So we took the teeth out and we put implants on the upper and lower, and
New teeth.
here he is. Doesn't he look fantastic?
Yeah, it looks nice.
He looks so much more younger with the new posture, the facial support in his lower half, and he's just beaming.
The
You
teeth
can
make
see
you
it.
look more attractive. We talked about that.
Oh yes, look at that smile. You know, he's just exuding so much confidence in there. It was hard to let that one go. He was going to Georgia. We're like, please don't go. We love you so much. And
So he can eat and chew whatever he wants.
he could eat and chew whatever he wants. Yeah, and he was just bewildered. Did you notice, Randy, that in the first picture, he looks like he's not giving you the full smile?
Yeah, he's kind of holding back a little.
Yeah, he's holding back. He's like he's hiding something. And in the second picture, he's starting to show a little more. He's still hiding a little bit, but the fact is that at some point when he gets used to it, then he gets used to the smile, then he's going to come out all the way. Okay, the next picture is somebody who we love so much. This is a grandma. She came in, and she used to actually work in a hospital as a medical coding person. And she came in, she looked angry. I thought she didn't like me. And when I told her what she needed, she was a little guarded. That may be because she was embarrassed about the way she looks and smiles. And she was holding her dentures, they were broken. And we said, what is it that you want? And she said she wanted her teeth. She wanted to enjoy her family. And she has a daughter, and the daughter has like a whole bunch of grandchildren. And we decided to give her teeth supported by implants again. And look at her now. Doesn't she look grand?
Very nice. Yeah,
so if I were one of her grandchildren, I came to her, which person do you think that is more approachable?
Yeah, definitely the one with the nice smile.
Yeah. Okay, this lady, she didn't want dentures at all. It was just totally not an option for her. She has been on house arrest, as she calls it. She's been in exile for like 3 years, and her mother is going
Because she was so self-conscious about her teeth?
Yes. Her mother's going bazookas because both of them are like in the same house, and she doesn't want to leave the house. And her mother wants her to go out and get a life. And she's really embarrassed. So one afternoon, we had her in, and we put her under conscious sedation. She had a pill. And her anxiety level went down because she does suffer from anxiety and insomnia. Look at her now. Doesn't she look smashing?
Nice. Very nice.
Yeah. Her mother came in and she was
New
so
look.
thankful. Absolutely. She's socializing. She's dating.
Okay.
Yeah.
Time for one more.
She wants to, she in fact wants to go to law school.
Well, that's nice.
Yes.
So they tell you all this.
They tell me
so
all
it's kind of
this.
like a new boost to their self-esteem.
Totally. Totally.
Like a better outlook in life.
Yes.
Okay.
And I was glad to be part of it.
All right.
And this patient here, he came in, broken partials, and again, we weren't able to save any of his teeth. He was on his way to his sister's funeral in Puerto Rico. So I had to get teeth to him straight away. So that one we had to do very, very fast. So in one afternoon, we brought him in. This guy, he's a private chef, musicologist. This one, he was dancing on the way out, okay? Look at that smile.
Good.
Isn't that amazing?
We're out of time. Final message. Somebody watching this, they're one of the two big categories. They're currently wearing a denture,
Yeah.
or they're headed to a denture. They've heard what you had to say, but they're still maybe a little bit afraid. What do you say to them? Or skeptical?
Well, I invite them in. Come in and have the free consultation. Let's talk about it. Let's see where you're at now. Let's see where you can be. We'll tell you what you need and what you can have, and you'll leave with a huge amount of options and information that you're able to execute when you're ready.
And we need to mention, Medicare doesn't cover this, Medicaid doesn't cover this, even the best dental insurance only covers a very small portion.
But Randy, we can finance this. My staff are well trained in accessing different financing that can help them realize the dental solutions. And, and you know, the finance can be a very unique situation. We have access to Care Credit, Lending Club, and many others. And we have different ways
So
of...
you have to have decent credit
Yes.
to get this done. Okay.
Yes. Yes, and we can stagger payments, and we can decide how to negotiate with the insurance people. There's always an answer to figure out the unique situation.
Okay, Dr. Low, pleasure having you on the show again. So thank you very much.
Thanks for having me, Randy.
All right.
Appreciate
You're
it.
watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.